Hello and welcome. My name is Dr. Jeremy Rode. I'm a respirologist from Vancouver and work at Vancouver General Hospital. Patients with COPD do experience difficulty breathing from time to time, and this video is going to show you techniques to help you cope with this breathing difficulty. Don't be afraid to watch the video several times until you feel comfortable with these techniques. COPD, particularly as it becomes more advanced, makes your breathing difficult, and increasing activity makes your breathing even more difficult. So learning to control the anxiety that's associated with this difficulty in breathing can allow you to feel more in control of what you're doing. And this will allow you to be more active, because if the difficulty breathing is allowed to limit your activity, then your general muscle function will decline and you'll become weaker. So learning to control your breathing muscles and controlling the anxiety associated with difficulty breathing can help you become more active. In general, it is wise to pace yourself. Sometimes we feel the urge to hurry and do things too quickly, and we'll quickly learn that that will lead to this difficulty with breathing and produce anxiety. So that planning and pacing your activity is very important. Alternatively to that, you can use breathing techniques to control your breathing when you are exercising so that you can continue to exercise. And as an alternate to that, also your inhaler, often your short-acting relieving medication, which can be Ventolin or Atrovent, can be used. And if this is used 5 to 10 minutes before the planned activity, this can relieve the dyspnea, or what we call dyspnea, meaning shortness of breath. This is an example of a Ventolin or a salbutamol inhaler that can be used in these situations. So to gain control of your breathing, the idea is to control how quickly you breathe out. So we're trying to slow your exhalation. So one way to start out is get yourself in a relaxed position, and then place your tongue on the roof of your mouth and breathe in. And as you breathe in, let your abdomen move out. And then when you relax, just let the abdomen move passively, quietly, and the air come out through your mouth. And when you do it, your tongue will fold to the bottom of your mouth, and then you just purse your lips. So you breathe in, and then breathe out, slowing the exhalation so that you're using purse-lipped breathing. So you're just closing your lips and making the aperture small so that you're breaking the air coming out of your mouth. And that slows the exhalation and allows the time for the air to come out of your lungs to be adequate. And that's what sometimes, if you breathe in too quickly after you breathe out, you haven't breathed out all the way out, and you start breathing in too quickly, then air gets trapped in your lungs, and this gradually makes you more short of breath. So it's very important to let the air come out, and this pursed lip breathing technique is very helpful at obtaining that. Now I will quickly review the 4 steps that I just talked about so that you can think to yourself about how you would do this. And this chart that we'll show is a 4-stage chart. And basically breathing in through your nose, so with the tongue at the roof of your mouth, in through your nose, and then relaxing, and as you breathe out through pursed lips, letting all the air come out. So you want to feel that you've emptied your lungs as much as possible before you take the next breath in. The controlled breathing technique is helpful in the resting position, but also can be very helpful when you're exerting yourself. And in this situation, we can call it the SOS technique, because you're experiencing a lot of shortness of breath, and so you can start doing the controlled breathing technique even when you're exerting yourself to slow your breathing down and feel less panic associated with the difficulty breathing. So the SOS technique, remember, is to slow your exhalation down. So when you get into a situation where your breathing is out of control, try and relax, get into a comfortable position, and take this time out to do this. And remember, your exhalation is going to be longer than your inhalation, and you're going to breathe out through the pursed lips. So relax your body, breathe in through your nose, and then out through your lips. And you can feel your diaphragm and your abdomen relaxing when you do this. And taking that prolonged exhalation is what really will restore your control over the breathing difficulty you're having. And you can do this for up to 5 minutes to regain control of the situation so that you don't become too panic-stricken. You'll find this will give you control in situations where your breathing becomes difficult. Now I will explain how this technique can be used in the sitting, standing, or lying down positions. In the sitting position, you need to lean forward with your hands between your legs and let your body relax, and then do the SOS maneuver. Or alternatively, you can keep your back straight and fold yourself forward on the table, resting your head sideways on a pillow, and then do the same technique. So basically just bending at the waist, at the hips, and then lying flat on the table with your head on one side, and then do the maneuver. That's for the sitting position. As you can see in the pictures, another way is in the standing position to lean against an object which you can support your chest on. So a high table, for example, or a windowsill, you can lean forward onto that, and in the standing position, do the SOS maneuver. This can work quite effectively, as you can see in the pictures as well. Alternatively, if there's nothing to lean against, you can put your feet about 12 inches away from the wall and then lean back and place your lower back and buttocks against the wall, and then lean forward just gently to let your arms hang loosely. So basically the wall is supporting you, and then you can do your SOS maneuver. So that's for the standing position. If you are lying down on your back, before you go on your back and you want to do the SOS maneuver, put three or four pillows on the bed, and then lie down on top of those pillows, and then do the SOS maneuver in the lying down position. So if you're still short of breath after trying the SOS maneuver in the lying down position, you can resort to using the puffer, in this case the Ventolin puffer, 2 puffs. Remember to allow 30 seconds between each puff so the chamber will fill, and shake it well. And I'm sure the important technique has already been outlined to you, and it's part of the education that you should know about using the inhaler properly. Please feel free to review this video again until you feel comfortable with these techniques. And I'm now going to summarize the techniques so that you can have a little capsule at the end. As you can see in the following chart, there are certain key points to remember. Keep active and strengthen your body to avoid feeling short of breath. When able to reach a relaxed resting position, use the controlled breathing technique. When feeling out of control and short of breath, use the SOS breathing technique. If you are still feeling short of breath after using these techniques, take 2 puffs of your blue quick relief inhaler. Thanks for joining us today. I hope you've learned something that will help you, and feel free to look at the pamphlet that will accompany this video to give you more information. Thank you.